Tips for OSCE preparation. What is an OSCE exam? An OSCE, which stands for Objective Structured Clinical Examination, is a form of evaluation used in medical education to assess the clinical skills and competency of medical students or healthcare professionals. 6 top tips for OSCE preparation. Tip 1. Use your reading time wisely. Your reading time is the most important part of your station. This is where you discover the OSCE station purpose. Read through the candidate instructions, and if you're allowed, highlight or underline keywords. This can help focus you when you are already under pressure. Tip 2. Histories aren't focused enough. Many students try to race through stations as they feel it is not possible to get through all the information in the time provided. This, however, is not the case, as all stations are time-tested to ensure the average candidate can complete the task. Start with general questions about the symptom and then focus on the specific questions that help you determine possible causes. Tip 3. Communication with the patient. Students are so focused on thinking of the next question that they do not respond or interact with what the actor is actually telling them. The key to an OSCE station is listening, processing, and responding appropriately to information provided. Tip 4. Examination skills aren't polished. Don't forget to wash hands and don the correct PPE, as it's such an easy mark to miss, where not only does this lose you a mark, but it can cause you to be thrown off during the exam. For every history and examination, it is essential to gain valid consent. Tip 5. Struggle finding a differential. When students are examining or taking a history, they need to have a think about their differentials diagnosis and appropriately excluding conditions from that list. Many students are able to come up with the diagnosis but struggle to think of any other differentials. For most stations, you will be required to think of 2 or 3 differentials. In many cases, this can be vaguely related to the area of concern. Tip 6. Investigations given are irrelevant. Always start with bedside tests, ECG, urine dip, peak flow, then blood tests, FBC, UNEs, LFTs, CRP, amylase GNS, blood cultures, and then simple imaging. Most of the time, this simple structure stops you from missing out any necessary tests. Keep practicing, as practice can make permanent. Subscribe to the channel for more.